out of... Okay. Hi, Glenda. I'm sorry. I had to step out. I'm out of hand sanitizer. But that's okay. How are you doing today? Oh, you're not feeling so well. Having a hard time breathing. And okay. You've got some pressure in your bladder. Oh, that's terrible. I'm so sorry about that. Well, my name is Katie, and today I am gonna come in here and do a baseline assessment of you, and then we will give you some pain medication, wait for that to take effect, and then we'll put in your Foley catheter, okay? And remember, they did that last night because you had a little bit of pressure in your bladder and you couldn't relieve yourself all the way. Okay, so I'm gonna gather my supplies and I will be right back. Let's see, I want some more hand sanitizer. Okay. So baseline assessment, I just go from top to bottom and just assess everything, make sure everything's doing well. And then, so let's see, your aide did your vital signs. It looks like you've got some hypertension going on. Your blood pressure is a little elevated, and your pulse it's good. It's 88, so we can be between 60 and 100 and be okay. And then your respirations are right at 20. Your oxygen is great at 94, and your temperature is 37.5, so you don't have a fever. Okay. Before I go any further, do you have any allergies? Are you taking any medications at home? Okay, yeah, that's right. No allergies, and you're taking lisinopril for your high blood pressure and naproxen. Are you taking that for pain? Okay, perfect. Naproxen at home. And okay, and you said that you had a headache? Okay, so yep, we'll give you your pain medication before we do your catheter to help ease all the discomforts before we do that procedure. So, all right, I'm gonna start with our baseline assessment. So let's see, before I get started, let me verify your name and your birth date. All right, Glenda. All right, perfect. And then let me shut the door to provide privacy. And then do you know today's date? Okay, perfect. And can you look over there on your bedside table? Do you know what time it is? And do you know where you're at? Okay, perfect. So you are alert and oriented ×3. You're conscious. Okay. And so now I'm going to ask you to smile. I'm just looking for droopiness or sign of neurological distress. Oh, excuse me, Glenda. All right, everything looks good. Okay, so I'm gonna come here and I'm gonna just feel you. Oh, I'm so sorry, dear. I'm just gonna feel. Would you mind? I know sometimes I have to wear a wig too. It's okay. Would you mind if I took it off just to feel your head? Okay, perfect. So I'm just gonna feel for any lumps and bumps on your facial features, your lymph nodes. Okay, I'll put that back on for you. Perfect. All right. So everything looks good neurologically. I'm gonna look in your eyes. So I'm gonna ask you to quote and your nose, your mouth, and your ears. Just checking for, well, your nose, mouth, and ears. I'm just looking for any impediment. And then with your eyes, I'm looking at your pupillary response. So I'm gonna cover your eyes. And I'm just looking at your pupils. Okay, perfect. Pupils are round, reactive to light, and let's do accommodation. Follow my pen, please. All right, you're doing good. All right, you passed that. Good job, Glenda. You almost get your gold star for the day. I'm gonna look in your ears if you'll turn this way. All right, that ear looks good. And turn your head this way. Thank you. Your earwax looks healthy. And I'm gonna look up your nose. There's nothing in there. And then can you stick out your tongue, look in your throat and at your nice teeth? You must brush your teeth really good, Glenda. Good job. Okay, so your pupils are perla. I don't see any lesions or sores in your mouth, ears, or nose. Next, I'm going to move down to your chest. So I'm going to listen to your heart in 5 areas, and I'm just going to inspect your chest really quick, making sure that, if that's okay. All right. Oh, Glenda, I need to breathe. All right, making sure that nothing looks abnormal. Okay, wonderful. So I'm going to listen to your aortic artery, pulmonary, Erb's point, tricuspid, and your mitral valve, okay? And this will take me just a little bit, so just be patient. All right, so let's listen to your aortic valve. Perfect. Your pulmonic valve. I'm going to listen to Erb's point right here. Tricuspid down here. And then your mitral valve I'm going to listen to for 1 minute, okay? Okay, perfect. Your rate and rhythm is appropriate. I'm not hearing anything that I shouldn't. I can clearly hear S1 and S2. Okay, perfect. So now I'm gonna kind of just look at your chest, seeing how it rises and falls appropriately. It doesn't look like you're, I know that with exertion and exercising you have a hard time breathing, but are you breathing okay right now? Okay, yep, you're relaxed. In the hospital, have you been experiencing a cough? You do. You have a productive cough. Okay, great. So I'm just going to listen for that. I'm going to listen to see if you have any wheezing or crackles in your lungs. I'm going to listen on the front, and then I'm going to sit you up and listen to the back. Okay? Perfect. You're doing so good, Glenda. Okay. And then when I put my stethoscope down here, just take a deep breath in and out. Good job. And again. Okay, and again. Good job. And again. Good job. And again. Perfect. One more time. And again. Okay, all right. Can I help you? Let me see with your legs. Let's lower your legs a little bit so we can help you sit up a little bit. And maybe let's straighten your legs so that I can help you sit up. Okay, grab onto my hand. We're gonna pull you forward. Good job. Okay, and I'm gonna listen to those same 6 areas on the back, listening for crackles or wheezing. See how your cough is progressing. Okay, take a deep breath in and out. Good job. In and out. Good job. Another breath in and out. There we go. Another one and out. Okay, 2 more. Deep breath in and out. 1 more. Deep breath in and out. Okay. So Glenda, I know that you have a productive cough, but I think it's more traveling up into your chest. We'll talk to your doctor about that, but your lungs are sounding healthy to me. And so that cough is probably resolving itself, but we'll double check all of that with your provider, okay? Okay. So we've done your lungs, and now I'm gonna lay you down and we're gonna look at your stomach, and then I'm gonna listen to your stomach as well, okay? Okay. I'm just gonna uncover you just a little bit just so I can see your stomach. I kind of got to look at it when I was looking at your chest, but all right, let's see your stomach. Okay, so I'm gonna look at it. I'm just looking for any sores or lesions or bruising or anything that is anything other than intact skin, and it looks really good. So now I'm going to listen to 4 quadrants, and I'm just listening for bowel sounds. And then I'm going to listen right under your sternum to see if you have any bruise. Okay. Yeah, just sit there and relax. That's all you have to do. Okay, now the next side. Let's cover you a little bit more. All right. You must have just had lunch, huh? Your bowel sounds are very healthy. Okay, perfect. And speaking of healthy bowel sounds, your lungs, they were clear bilaterally, so that's a good thing to note. Okay, now I'm going to, now that I'm right here, do you have any issues with your vulva or your vagina or anything down there other than having a hard time urinating? Okay, so we'll take a look at that right before we do your catheter, okay? So, and then with your stomach, how are you when you use the restroom? Do you have, how are your bowel habits? Are they normal for you? Are you experiencing any constipation? No? Okay, that's good. So we've just got one thing to worry about there down there, okay? So now I am going to check for skin turgor, and that's just to see how hydrated you are. And so let's see, I pinched your skin, and I'm looking for any tenting. Let's see. Okay, perfect. So I was looking for any tenting, and I don't see any, so you are well hydrated. And I'm just gonna feel your arms and your skin to feel if it's cool or really warm. And then if you have any pain as I'm going down, would you please let me know? Okay, that side feels good. I'll come around here. I'll do this side. Okay. Oh my. Well, it looks like you have a lesion that is open, and I need to go wash my hands. I'll be right back. Just walk to your sink. Okay. So as I was, it doesn't look like it's draining at all on your bed pad, so that's good. So let me note that, and then I will go and talk to your doctor about that to see what they would like me to do about that. Maybe we should just put, I don't know if we should put anything over it. Let me check with your doctor and I'll get back to you on that. Okay, and then coming down here, everything looks fine. Okay, I'm gonna have you push and pull against my hands. Okay, push. Okay, good job, and pull. All right, perfect. And while I'm down here, I'm gonna check for your pedal pulse. All right, they are appropriate bilaterally. You can feel them. Okay, I'm gonna come up here and check for your radial pulse. All right, they are appropriate bilaterally as well. Okay, so I think I'm done with your baseline assessment. I'm gonna move on to giving you pain medication, okay? So let me just lower your bed so you're not in the sky so much, and then I'm gonna sit you up so we can give you a drink and get do that pain medication before I put in your Foley catheter. Okay, Glenda. I'm gonna go to the med closet and I'll be right back. Alright, so I'm here in the med closet. I'm going to do my hand hygiene. Since I left the patient's room, I'm gonna open up my computer. I'm all on real quick. Oh, there it is. Okay, I'm gonna open my DocuCare and look at my patient orders. Let's see, I'm gonna do Glenda Conk. Let's make sure. Glenda Kronk. Okay, perfect. I'm gonna go into my MAR and look. She has an order for acetaminophen, 650 milligrams as needed, and every 6 hours. But it's as needed for pain. Okay. So I am going to administer this medication. And so my first med check is when I pick it up and I see that it says acetaminophen 325 milligrams and it's a tablet. And then my second was checking on the MAR, and then my third will be at the bedside. Okay, so let's see. Right now I confirmed I have the right patient, the right drug, the right dose, the right route, the right time, and then I haven't completed my 3 checks quite yet. And then my secondary check is going to be the birth date, and then alright, let's see. That is not going to have me scan anything. Okay. Okay, so now I'm going to come up here, and it's 650 milligrams. So 325 times 2 is 650. Okay, perfect. So I'm gonna get a med cup. I'm gonna dump in. Oh, but the real way I would do it is I would, well, I guess I can use the med cup because there's nothing in there besides this. So I'm gonna get 2 pills. Okay, and then I'm gonna walk into my patient's room. Alright. Hi Glenda, I've got that acetaminophen for you. We're gonna have you take it, and then hopefully your headache will have eased up by the time I put in your Foley catheter, okay? Alright, you've got plenty of water here. Okay, so I'm gonna have you sit up just a little bit more. Okay, can you see right here? This is acetaminophen, 325 milligrams per tablet, and there's 2 tablets, so that's 650 milligrams that you can have every 6 hours as needed, okay? All right, I'll have you take off your lid so you can drink your water. Perfect. All right, well, I guess first we'll have you put the pills in your hand. All right, get those in your mouth. Good job. Now I'll have you drink your water. Okay. Are you got them down? Okay, perfect. Good job. Okay, I'll lower you back down so that you can relax. Okay, and I'll be back in just a minute to do your Foley calf. Okay. So I'm gonna come and chart. Patient tolerated taking medication well, and then it was administered, and I did my 3 checks. At the bedside was my 3rd check. Okay, perfect. Now I'm gonna check on the MAR. I heard in a report that I needed to give her insert a catheter. So I'm gonna come here and double check. She has order for a Foley catheter. Yep, interdwelling urinary catheter. Okay. It was ordered today, and it's time to do the catheter. Okay, so I'm doing another check for my catheter that I've got the right patient, the right dose, and all of that. That doesn't really apply with the catheter, but I have the right patient. I know what kind of catheter I'm doing. It's the right time for the right reason. And so I will go in and I will set up to put a catheter in. Okay. Hi Glenda, I'm here again. How's your head feeling? Is it feeling okay? All right, it's feeling a lot better. All right, so let me just verify your name and your birth date real quick. Okay, Glenda Kronk, your birthday, perfect. All right, and I realized that I did not verify your name and your birth date before I gave you your medication. I'm so sorry about that. That is not a good decision on my part. Okay, so let's see. Let's just put all of our things together. Now, shall we? I just want to make sure I have enough room to do your procedure. Everything I need right here. So very first, I'm going to help you get into the correct position. And then we will clean your labia and your vulva and make sure that everything is clean, because this is a sterile procedure. So once I have everything set up, I ask you to please keep your hands to yourself and not touch any of my equipment or your body, okay? Let's raise the bed a little bit. Okay, and I'm gonna have you lay your head back. Oh, wrong buttons. I'm sorry, Glenda. All the buttons are always so different. Excuse me, I have a dry throat today. Okay, so I'm gonna pull your blankets down just a little bit to expose the area that I need to clean. I'm gonna make sure I have my trash can, which is on the side. Okay, perfect. Everything ready. So I'm gonna make sure to clean the sides. Okay, and then with a new part of my wipe, clean the other side. And then with a new wipe, I will clean down the middle. And then one more, just to make sure everything is good and nothing looks soiled. Everything looks great and clean. Okay, so I'm gonna set your legs up so that I can, okay, and what hand? Okay, I'm gonna go around to the other side because I want my dirty hand to be my left hand. So I am gonna sit up over here. Give me just another minute, Glenda. You are so patient with me. Okay, I'm gonna go over to here. setup is not ideal, Glenda, but I think it will have to do just because of our situation and that I'm right-handed. Okay, so I bought my gloves and my maybe I'll put it right. Maybe that will be helpful. Okay, Glenda. So I am ready. Are you ready? Okay, I washed my hands. I'm gonna pull this down so we have plenty of room to work with. And actually, your leg went up pretty high, my friend. Okay, and the wound on your leg still looks good. It's not dripping anywhere. Okay, so I'm actually gonna scoot you closer to me so I can make sure that I stay as sterile as I can without touching anything. Okay, so we'll do our hand hygiene again. Get my gloves ready. So this is not a comfortable procedure, Glenda, which you understand. You had it done last night, and I understand, right? And so you kind of know what to expect. But just a lot of deep breaths for this, and we'll get through it together, okay? All right, and this is my label for my Foley cath. Okay, and I'm gonna open it away from myself first. And I'm gonna open it this way. Remembering that there is a 1-inch margin around my sterile field. I can get everything straight open. Okay, so I am going to give these sterile gloves a try, and I'm never turning my back to my sterile field. Okay, so I'm going to put on my non-dominant hand first. And yes, Glenda, I have struggled with, we're not even gonna try these. We'll just go with the bigger size. Does that sound all right to you? Okay. Yes, I struggle with sterile gloves. I always have since I was a tiny little nursing school student, but I know that I will get it someday. Okay, Glenda. How are you feeling? I know it's a little chilly in here. I'm sorry. We'll get this over with so we can get you that comfortable, okay? Oh, and Glenda, I touched my sterile field. So, in the real world, I need to go and, I think I need to start over. Because my gloves touched my sterile field. So if I had another kit and this wasn't a mannequin, then I would go get a new kit because my gloves touched my sterile field. And that's why we have 2 tables, but I didn't feel comfortable turning around because then I wouldn't be facing my sterile field. So anyway, I will start with my non-dominant hand, put on my gloves. Yes, Glenda, these are much better. Thank you for that suggestion. Okay, now I'll also take off my watch, so that won't be an issue. And then the outside is sterile of these. So when I get these on. Okay. Making sure not to touch my skin. Okay, now I can fix this part. My goodness, you are so patient, Glenda. What was your husband like? Is he still alive? My husband's great, but you still have to be patient with him, huh? Okay, we are all ready. Okay, so I'm gonna put this down, and this just kind of gives me another sterile area to work with. And I will make sure to not touch anything except the inside. Okay, perfect. Put that out of the way. This is a frenulated drape that just, again, gives me some more sterile area to work with. I'm gonna get my supplies ready. Look, they really don't want us to forget to document. All right, there's an extra one. So I will open my swabs. There we go. They're down here. Okay, I'm gonna open my lubrication. So I'm gonna lubricate the end of this catheter tubing so that it goes in as easily as it can. Okay, Glenda. I'm also going to be very cautious taking the end of this packaging off so that I don't create anything that is unsterile. And then Glenda, I'm going to insert the end of this tube 2 to 3 inches, and then I'm going to insert it just a tiny bit more to make sure we're up high enough, and then I'll inflate the balloon, and we will have got through this. Okay, so I'm going to put as much tubing in there as I can. Put that back in. I want to keep everything sterile. I'm gonna pop my seal, and then get that hooked up in there. Okay, are you ready for this? Okay, so I'm gonna move my whole situation over to you, and I'm not gonna touch anything that is not sterile. Okay, Glenda. So very first, my left hand is going to be dirty now. I'm gonna hold open your labia while I clean. Okay, and I'll just clean one side at a time. Okay, good job. On the other side. How are you doing? Are you handling this okay? I know it's uncomfortable. All right, and then one down the middle. All right, you're doing so good. Okay. And I'm gonna find the meatus. Perfect. Okay. Are you ready? As I insert this, I need you to breathe, okay? Okay. I'm not gonna touch anything I shouldn't. Okay, let's get it in there. Glenda, take some deep breaths as we go in, okay? Take a deep breath. Breathe with me. Take a deep breath, Glenda. We're just gonna go nice and slow, okay? Okay, we're up as high as we're gonna go, so I'm gonna hold it because I'm not going up any higher. And I'm gonna look right here. It tells me to inflate the bubble with 5 mils, so not to inflate it more than 5 mils. Okay, Glenda, so we're gonna inflate the bubble now. Okay, and before I take this off, I'm just gonna give it a little tug. Make sure it's in, it's secure. Good job. Okay, and now nothing is sterile anymore. Perfect, Glenda. I'm so proud of you. You handled this amazing. And now if I needed to get a urine sample, I could get it from this bag. And then I'm going to make sure to attach this to my bed frame and not to the railing. Okay, perfect. And everything is open, draining well. Okay, I will clean you up and get you comfortable. How are you feeling? Do you have any pain with this? Oh, it is pulling you, all right. So I'm gonna take this right here. And then I'm not gonna forget, I'm gonna put this on my catheter bag, so I'm gonna date it, put my initials on it, and everything will be great, okay? So let's get you covered up. Okay. And then Glenda, I'm gonna document all of this, and I'm going to go talk to your doctor about that wound on your leg to see if he'd like me to come back and do anything for you, because that is not in my orders right now, but I will check back with you. I'll document anything, and then with your catheter, I just want you to not tug on it, don't touch it, really, because the more that you tug on it and touch it, you could increase the risk for infection, okay? So we worked really hard not to infect, not to spread infection as we were putting your catheter in. So we just want to try really hard to continue to do that, okay? All right, and I'll take my extra supplies out of your way. Oh goodness. I'll wash my hands again. I'll leave you with your call light. Okay. And I will be back in just a little bit. Here's some water for you. Thank you.